Movies have a way of making dentists appear sadistic or psychotic, and I literally feel like almost anything involving dentistry in movies is straight up terrifying. So in this video, I'm gonna do something new and react to some of the most wild and disturbing dental scenes I've seen in movies. So I know Squid Game is a show, not a movie technically, but I love Squid Game, and when I saw this scene, I knew I had to make a reaction to it.
하세요.
Oh God, he's literally taking his tooth out. Oh God, that scene just looks terrifying. So first off, he's extracting a bottom tooth, but he's holding those forceps upside down. So if you pause the image there, you can see that those forceps beaks are basically pointing up. You would think that he's taking out a top tooth, but those forceps are actually meant for lower teeth, and he's actually taking out a lower tooth, but he's holding the tool upside down. So if a dentist is approaching me like that, I would definitely run away. Oh my God, that looks so painful. I also didn't get this, like if you're able to bring forceps and tools into this office, like why not bring numbing stuff too? Like dental extractions don't have to be this painful. It can actually be like a little bit more of a comfortable process if you're numb. Oh my gosh, I heard something snap. Okay, I'm surprised that that tooth came out in one piece. You can see both roots there. It doesn't look like anything fractured or broke at all, so he was able to get the whole tooth out. And I also don't see any fractured bone pieces or anything like that. So it looks like a clean extraction. Normally, this is not actually how we take a tooth out. You can see that he's actually holding those forceps with those beaks facing up. Again, that's not how you would take that tooth out. But normally, forceps are the last tool that we use. That's usually when the tooth is already super loose and we're confident we can just get it out pretty easily, because there's other tools that we use, like elevators, for example, that slowly loosen the tooth from the bone and kind of expand the bone a little bit. And that basically prevents us from breaking people's jaws or breaking roots off in their jaw. And now he got what's called a flipper. So this is basically a tooth replacement. And I'm surprised they already had this made, because in order to fit a tooth replacement in the mouth, you have to kind of have like a mold or impression of what that mouth looks like before. You can't just have like a random tooth with these two hooks on it and assume it's gonna fit in everybody's mouth, because everyone's mouth and shape of their teeth and everything is just different. So he's putting it in the mouth, and I guess it fit him perfectly because he's not having any issues. And there's a tracker in it too.
There's gotta be...
Oh, I hate the Saw movies. I love them, but I hate them.
Before you is the door that leads to your wife. However, you must first make a choice. As you may have guessed, your decision will be as difficult as pulling teeth.
Oh, pulling teeth again.
Before you requires a 4-digit combination to open. However, if it is access you seek, then a true sacrifice will have to be made.
So he literally has to pull out his teeth and find a digit or a code on these teeth in order to save his wife.
Watch and learn, Bobby.
There's a video demonstration of how to take out the teeth. Okay, they do not come out that easily.
On to 2 of your teeth.
It's the wisdom teeth too. It does not just pop out like that.
Reference for
I wish it did. My job would be a lot easier.
order to enter the digit.
And he has a clue of which way to enter the code. He has to take out both of his top wisdom teeth.
Decision quickly.
I don't want you to see this.
Honestly, this isn't so bad. Like, a lot of people do need to get their wisdom teeth taken out, and he did give a pretty interesting looking tool that can probably get back there pretty well if you were taking your own out. Oh, he's getting back there. It's always this crunching sound. Now, that's not the tool I would use to take out my wisdom tooth. First of all, we don't have any x-rays or anything, so we don't know what the shape of his tooth could be, so this could actually pose to be really difficult. But I do not like to use forceps in the back on the wisdom tooth at all, because it can actually cause more problems. Usually, I like to use that elevator I was talking about before, and usually those wisdom teeth have really conical roots where they're not like really separated. And a lot of times, if you just put that elevator in between that wisdom tooth and the tooth in front of it, and you start pushing against that wisdom tooth, it just works itself out like really quickly. Let's see how he's doing. Oh, he's yanking on it. That's not how it, and there's usually not that much blood when taking out a wisdom tooth. Like, at any tooth, like it shouldn't be profusely bleeding like that. Something probably went wrong. So many dramatic effects here. He's about to just spewing out blood. Oh my God, it looks like he got it. And it looks like he got the whole root too, so props to him. All right, he got both teeth, and somehow there was a code. How did he etch the code? I never watched this full movie, so if one of you guys know in the comments, how the heck would he etch the code into the root of those wisdom teeth? That is like burned in there. Like, I don't know how the heck someone could do that. Is like amazing. Now, going back to that tool that he used, again, I would not just put forceps on it and yank on it like that, because like I said, this can actually cause more problems. Up there, we have what's called a maxillary tuberosity. So that's basically the bone that is where that wisdom tooth is attached to. And if that thing breaks, which it probably would if you're yanking on it that hard, then this could be bad. And this can actually lead to what we call an OAC, or oroantral communication. This is basically when that bone breaks off and it leads into your sinus. So now there's literally a hole from your jaw into your sinus. Now, depending on how big this is, this could be a problem if you don't address it right away. And if it's spewing that much blood, my guess is he probably did damage one of those structures. This could lead to a sinus infection. This could spread to other areas if it's not fixed right away. I freaking love The Hangover.
Phil, there is a tiger in the bathroom.
What's going on?
There's a jungle cat in the bathroom.
Okay. I'll check it out.
Go in.
Look at this place. I know, Phil. They have my credit card downstairs. I'm so screwed. What the fuck happened last night? Hey, Phil, am I missing a tooth? I can't. Oh.
This guy literally woke up with a missing tooth. I remember the scene, and he's the dentist in the movie. I remember watching, like, I can't imagine waking up with a missing tooth. This is literally some of my nightmares.
I can't. Oh my.
Yeah, he still has blood on his lip from it.
My lateral incisors, it's gone. Okay.
So your lateral incisor is like the name sounds. It's one of your incisors, but it's on the lateral side. So your two front teeth are called your central incisors, and then the ones next to it are your lateral incisors. And all of them are important. They're in your smile zone, and if you lose one of them, people are gonna notice.
Just calm down. We're fine. Everything's fine. Alan, go wake up Doug. Let's just get some coffee in us to get the fuck out of the bottom before housekeeping shows.
What am I gonna tell Melissa? I lost a tooth. I
don't know how you lose a tooth and have no idea how. Like, I don't know what drugs you have to take for it to be that bad. Oh, I remember the scene in Finding Nemo.
I said we got a live one.
Yes!
What do we got?
Root canal, and by the looks of those x-rays, it's not gonna be pretty.
I love how the starfish is looking at the x-rays and just knows that it's gonna be a root canal. Oh my gosh, that should not be happening. I love how these movies are just like, yeah, anytime a dentist is working, people are screaming in pain like that. If someone is screaming like that, that means that they are not numb. And you have to wait for them to be fully numb when you were working on them. They should not be screaming like that.
Rubber dam and clamp installed?
Yep.
I love that. He said rubber dam and clamp installed. So whenever you do a root canal in dentistry, so a root canal is basically where you have a really big cavity, for example, it gets into your nerve. The only way to fix that tooth is to clean out that cavity and also clean out that nerve. And the gold standard in dentistry is when you're doing that, you have to have what's called a rubber dam on the tooth. The rubber dam is like this rubber piece. It goes around that tooth and it basically isolates that tooth, prevents any bacteria, it protects the patient, protects the patient's throat, and it really helps you visualize and just focus on that tooth so no other bacteria get inside of it.
What did he use to open?
Gator Glidden drill. He seems to be favoring that one lately.
Wow, I love all the dental terminology. So they were talking about a Gator Glidden drill. This is literally one of the drills that some endodontists and some dentists, when they're doing root canals, what they use to kind of open the opening of that canal. Not like the whole root canal, that's what they call like, what did he use to open? This literally sounds like some of my assistants, like how they talk, like, oh, he's favoring that one lately. Because literally some of us dentists, like we literally start favoring one thing and like, hey, we're gonna start using this. And then for a few months, we start using this new drill and then we change our mind. We're like, hey, you know, I actually like the feel of this one better. And then we change our mind again.
Oh, I can't see, Flo.
So first off, there's no rubber dam installed. You saw the picture of a rubber dam and there is clearly no rubber dam in this tooth. So I don't know what the heck they were talking about with a rubber dam or clamp installed. And now he's using a file to go into this is called a hand file. And this literally just goes inside of the canals to help kind of clean it out and shape it.
Now he's doing the Schilder technique.
Oh, he's using a headstrum file.
Again, it should not sound like that. Also, that dentist is not wearing a mask. So the Schilder technique that they talked about, it doesn't sound like it's that because that's usually what we do at the end of the root canal. And this is probably like the middle part of the root canal. And the other official's talking about a headstrum file. That's probably more likely what it is because that's one of those hand files.
That's not a headstrom file. That's a K-flex.
It's got a teardrop cross-section. Clearly a headstrom.
No, K-flex.
Headstrom.
K-flex!
K-flex and a headstrom are two different types of those hand files. And I love how the other fish noticed that teardrop cross section. So they definitely did their research. If it is truly a teardrop cross section, that means it is a headstrom file. So no, typically headstrom files are used in like a pulling motion. They'll put it in and it doesn't cut the canal as it goes in, but as the dentist pulls it out, that's how it cuts. But the K-Flex, on the other hand, you kind of do this watch winding technique where you kind of move your fingers back and forth, and that's how it goes down and cuts through the canal.
There I go. Little help over here.
I'll go deflate him.
All right, go ahead and rinse.
He's making a mistake. Clearly there's no rubber dam, and that is disgusting. We used to have those sinks back in the day in dentistry, and I just think that they're disgusting. I'd rather just suction it out with the suction than have just a pile of their bloody and like messy gunk in a sink.
Hey, Nigel.
What did I miss? Am I late?
Root canal, and it's a doozy.
Everyone's so interested in the dentistry.
Gator Glidden drill.
He's been favoring that one. Hope he doesn't get surplus silver at the secondary portal terminus. Hello? Who's this?
New guy.
The dentist took him off the reef.
And howdy. From my neck of the woods, eh? Sorry if I ever took a snap at you. Fish gotta swim, birds gotta eat.
Hey! No. Those aren't your fish. They're my fish. Come on, go. Go on, chew. Ah, the picture broke.
He also shouldn't be using his gloves to kind of touch everything. Can you imagine like working in someone's mouth and trying to keep everything really clean and then using those same gloves to just touch everything? First of all, you're spreading all those germs to everything. Now there's more stuff to like wipe and clean down. And then if you don't change your gloves, that's disgusting because now you're gonna put all the other stuff that you touched back in that patient's mouth.
Okay. Millie, stop.
I watched this movie recently and it was absolutely crazy. So basically, backstory, you don't really need to know much. Basically, this guy's crazy. She locks him in a room and says you have to pull out your front tooth in order to come out.
Hey, I'll do it.
She gives him a pair of pliers.
I wanna watch.
Okay.
Oh my gosh. It doesn't sound like he's trying so hard. Ouch. You hear all the crunchy noises again? It sounds like he's just like crushing the tooth. It's not like he's actually like trying to get it out. I'll tell you how to get that front tooth out in a second. Oh, he got it out. So YouTube kind of cut out the part where he's actually pulling it out, but he was basically just kind of just ripping it out. A lot of people think that when you take a tooth out, you have to literally rip it out of your jaw. That's really not what we're doing at all. We're actually trying to, again, expand that bone and separate that root from those ligaments so the tooth kind of works itself out. And the reason is it's just one root and it's usually very straight. So when you have one root that's like really straight and it kind of tapers in like this, all you really need to do is take a pair of forceps, not those type of forceps. Instead of going like forward and back and like yanking it out, you just need to kind of rotate. Just hold it in one direction, like rotate it clockwise, rotate it counterclockwise, and eventually all those ligaments holding it into the bone will snap and then it'll just work itself out and it'll be super clean and you won't break anything. If you do it the way that he did it in this video, then you're probably going to break something. Typically, it would involve what we call the buccal plate. So the buccal plate is basically that bone that is housing that tooth, but like the bone facing the lip. That bone is really crucial. We're really careful whenever we're taking out a front tooth to not break any part of the bone, because once you lose it, it's really hard to get it back and get that volume back. And what does that mean? If you ever do a tooth replacement, like a bridge or an implant or anything, if you have missing bone, it means your gums are going to follow. And if your gums are following, that means your eventual tooth replacement is going to look really long and really janky, and it's not going to look as good. So if you maintain that bone and keep everything really clean, then the final result, whenever you get a tooth replacement in there, is going to look so much better. It's going to look a lot more natural. I want to see if you got the whole tooth out. Pause it there. It doesn't even look like a central incisor. It looks kind of more like a canine the way she's holding it, but obviously it's not real. This video was trippy. I love how all these dental instruments just look like a torture device.
Relax.
So it looks like he picked up a mirror and a scaler. So that either looks like a scaler or what we call a perioprobe. Normally a scaler is a lot narrower and it's more of like a hook appearance, and you have a hook on both sides. That just looks like one giant fish hook on one side. And it doesn't really look like a perioprobe because perioprobes normally have these markings on them that kind of measure the measurement of your gums or whatever we're trying to measure in the mouth. But this is an old movie, so maybe it's like an older tool or something. putting them in a headlock. So a lot of times like pediatric dentists will actually use this technique on kids when they're just flailing their arms around and stuff, but you gotta get the work done. If you put them in a headlock, sounds like it's barbaric, but it's actually safer for the kid because instead of them moving around and potentially getting cut from the drill or whatever sharp instruments we're using, if you can hold them in the same place, then you won't hurt them.
That hurt? No, I should think it would. Should take better care of your teeth. You have quite a cavity here.
You found a cavity.
Is it safe? Look, I tell you, I can't do it.
Oh, so he's literally stabbing him with that tool.
Think he knows?
Of course.
So I couldn't tell if he stabbed the cavity or if he stabbed the gums. If he stabbed the cavity, normally touching cavities with an explorer or an instrument doesn't really hurt the patient, even if they're not numb, unless that cavity's going into the nerve. So he's right, you probably should have taken better care of your teeth. If that cavity's going into the nerve and you literally stab the nerve with that instrument, that could hurt the patient. But in that case, the patient would probably know he's feeling that pain before he comes in. Or he could have just stabbed the gums, and that's always gonna be painful.
Of course he knows he's being very stubborn.
What does he have here? Is that alcohol?
Please don't.
What is he putting on there?
No, it's okay.
Not using any gloves and just sweaty hands, it's just gross. Oh, it's helping.
Is it not remarkable? Simple oil of cloves.
Oh, clove oil. Clove oil is actually a natural remedy that people can use if they have like a toothache or even an infection. Obviously, it's not a long-term fix, but if you're like in a pinch and you're in a ton of pain, you just want to get some relief, literally putting some clove oil on the gums and around the tooth like that can actually help. And that's because it actually has eugenol in it, and this can kind of help numb the tooth and help with the pain. Oh, we're just grabbing a tool. Oh my gosh.
You'll be a success.
Oh my God, that does not. He just literally rotating that tool like 180, 360 degrees. And he just left it there? This is what I mean. Some of these movies just make dentists look crazy. Like, we're not this crazy, but I do understand now why people are so scared to come to the dentist, because movies like this are out there. And this might have been people's experience back in the day, but I promise you that is not the case nowadays. Oh, that nitrous. I've thought about doing that before. Just kidding. Okay, that syringe is huge. So we never use a needle that looks like that. That needle itself actually doesn't look too big, but this actual syringe and whatever the heck he's putting in there is absolutely gigantic. At least it's getting him numb though. Oh my God. Oh, he's starting right away. He said he's not numb. He's not letting him get numb before he gets started.
Open wide, here I come.
Oh my God. I wish I could work on patients like this where they open that big. That would make our job so much easier. He's done. He didn't even do a filling. He just drilled it out and left.
I drill when I drill a bicuspid.
So a bicuspid is actually a premolar. It's just another name for a premolar.
It's swell, though they tell me I'm maladjusted. And though
Oh, he's literally hiding on the ceiling. I've never had a patient do that before. I've had them hide from me in the chair before, literally, like a new patient when I'm walking in, but never on the ceiling.
say ah.
Why is he doing that?
Say ah.
Literally drowning the patient. Oh my God, that is terrifying. Well, I'm not really sure what I can make out of that one. That was definitely entertaining though. But that was all the videos I had to react to today. I would just say, don't listen to everything you see online or in movies, because it is not always how it is in the real world. But anyways, thank you guys for watching. I hope you liked that video. If you have any other videos or any content you want me to make or react to, let me know in the comment section below. And if you haven't already, hit that thumbs up button and subscribe to my channel below. And I will see you in the next video. We often hear that gum disease is caused by not brushing or not flossing enough, but that's only part of the picture. You see, there's a whole other aspect to the health of your mouth and the health of your gums. And this includes things like the pH of your mouth, your biofilm or the bacteria that are in your mouth, and your diet. So in this video, I want to talk about a new study that came out talking about a nutrient found in tomatoes.